Hello guys, so it's another video. We finished the previous software, the banking software, and I already released it. It's on my website. You can download and test it. And right now I want to start a new one. It's going to be an open source hospital management system. And in this video, I'm going to show you all the modules that I'm going to be covering. So as you can see here, I have the dashboard module. It's going to contain these details. Then I have the patient module, of course, for adding patients, updating, searching them, viewing their visit history, managing their medical history. Then we have the appointments module, of course, for scheduling appointments and tracking them, for sending reminders. Then we have visits or the consultations module, of course, for visits for the patients, these patients. So we have a lot of relationships here. Then we have electronic medical records, was for storing patient records, including their labs, prescriptions, the diseases and treatments. We have the laboratory management, was for tracking patients' laboratory data. So for printing lab reports, enter test results, track samples. We have radiology, of course, here we're talking about X-rays, ultrasound and CT, MRIs. All this is going to be dealing with a lot of images and patient records. Of course, all these are related to the patient. Then we have the pharmacy management. This is dealing with the issuing of drugs and tracking them, expiry dates, the stock management of the pharmacy, of course. Then we are talking about the stores management for tracking medical supplies. Of course, the items that are owned by the company, by the hospital. Then we have the billing and invoicing for generating the patient bills, services, print receipts, track payments, handle debts, and so on. So it's all about finances. And in this case, we have the next module, we have the insurance and claims module. In this case, we are trying to look at insurance companies, and of course, for the patients which have a specific insurance, now they can use to be paid. Then we have the wards and admissions. These are people who are admitted in the hospital. Of course, it's all about beds, food, and monitoring and everything. We have the emergency, was for recording emergency. We have the staff management. This is one for human resource management, so that you can track the staff records, their role, their shift, the attendance, the payroll. User account management. This is admin-based reports, patient statistics, disease trends, revenue reports, pharmacy stock. Wow, I think this is a really solid software. Okay. We have referrals, of course, refer patients to other hospitals. Maybe a patient came in, you can't treat them, you just refer them to the next hospital. Then we have notifications, of course, it's alerting when a certain drug is limited, remind appointments to doctors, giving attendance to nurses so that they can check on a patient. Then we have a backup. Now this one I have to come up with an own custom backup and data recovery module so that it can be used to do that. Yes. Then we have the settings configurations, of course, for setting notification alerts and so on. Then we have the audit trails. Of course, this one is for tracking user actions, monitor data changes. This is for accountability and security. Then we have for the public health reporting. This is for the government, of course, if they need to print reports, collection, geostatistics, and data to use this. So these are the modules. Of course, I already have the collections here. I think I'm ready to start developing this system. It's going to be on a GitHub repo. Once I'm done with the software, I'm going to release it, and then you guys can test it out. And in the meantime, I'll just be developing a module, and then I will be sharing my progress on YouTube and on my X. So thank you, and see you in the next video.